Hey girl, hey, it's your birth bestie, Nurse Rini, and I am back with a Reddit story for you. So I'm coming to you with this Reddit story because this is not uncommon that I've seen in the our gestational diabetes or our pregnancy subreddits, and it's something I'm very particularly passionate about, as you may see from some of my other videos. But I'm going to put this post up on the screen and let's talk about it, and then I will give you my response. Okay, so this post says, refusing 38-week induction. I'm 41, almost 38 weeks pregnant, diagnosed with GD 3 months ago. For the most part, it is diet controlled, but I take 6 units of insulin before bed to control fasting numbers. Baby measured 65% 3 weeks ago, and I don't have other issues. Actually, I have plenty of amniotic fluid, apparently. The guidelines in my country recommend induction at 39 weeks if you are over 40 and 38 weeks if you're on insulin. I was shocked to hear that such a low dose of insulin would mean 38 weeks induction. However, after a discussion with my doctors, they admitted that the 38 weeks recommendation is not really well founded. It is based on a study done on type 1 diabetes in pregnant women, and their words, not mine, quote, "It's a whole different condition." So I pushed back, and they are convinced that we can wait until 39 weeks. I am now tempted to wait until 39 and 3 because this is when labor signs started with my first, and I gave birth at 39 and 6. Question: is this smart? Am I pushing my luck? Am I risking my baby? I think my doctors would go along with whatever I say as long as I don't insist to wait for 40 weeks. I know these recommendations are wildly different from one country to another. That's why I'm asking you ladies, would you go with 39 weeks or 39 and 3, or would it not matter so much? Now, this post annoyed me. And I'm going to tell you why. Because she's asking, again, lay people that she doesn't know, who may or may not have medical knowledge, who may or may not even have gestational diabetes. I don't have gestational diabetes. I'm just in the, subreddit, right? So she's asking these people that she doesn't know whether or not this is the best decision. Yet she is paying someone who has studied, who has gone through training, and probably now has years of practice in dismissing what they're saying. And she's asking the internet if this is smart or if she's pushing her luck. So you guys know I'm passionate about this because I remember there was a post a few weeks ago, and I told you guys about it, where the woman also came to the internet asking for advice. And which is, okay, she did that. But then someone gave her bad information. And so, I really feel some type of way. If the approach were, what has your experience been? I'm thinking about X, Y, and Z. What has your experience been? You know what I'm saying? But to say, I'm going to do this against my doctor's recommendation, and I'm going to ask the internet full of strangers whether or not this is a good idea. I mean, like, when you think of that, does that sound smart? And I'm not even trying to be mean, but I am trying to be real, and I'm very real. So sorry. But this was my response. Your diabetes isn't technically, matter of fact, let's go back through her post and break it down with a medical or clinical eye. I'm 41 years old, so she's at advanced maternal age, right? And now she's 38 weeks pregnant. So she's full term. Full term is at 37 weeks and beyond. She was diagnosed with gestational diabetes 3 months ago, okay? For the most part, you have to listen to those keywords. And in fact, the other person who had posted in this subreddit before had also said for the most part, it is diet controlled. But I take 6 units of insulin before bed to control fasting numbers. Then it's not diet controlled. It's just not. It's insulin controlled, right? So you have to listen for those keywords and read what people are saying. And this can be confusing for some, and some can be like, oh, it's controlled. She said it's controlled, but she's also taking 6, units of insulin. So it's definitely not. And she's taking 6 units to control her fasting numbers, which means she has gone to sleep and not eaten for hours. And she wakes up and she has elevated blood sugars. So it's not controlled, guys. So she said her baby's measuring 65% percentile about 3 weeks ago. So it's been several weeks. So I'm surprised they don't have an updated measurement or estimated fetal weight. But she said she doesn't have other issues. Actually, I have plenty of amniotic fluid, apparently. Now, she doesn't go into what this exactly means or how much amniotic fluid she has, but there are conditions with surrounding amniotic fluid. So you can have oligohydramnios, which is too little fluid. You can have, regular amniotic fluid. And you can have polyhydramnios, which is too much fluid. And having too much fluid is one of the, symptoms of diabetes, or one of the side effects of having gestational diabetes, which we know she has. So if she has an excess of amniotic fluid, which she doesn't necessarily say it's an excess, she just says it's plentiful, then this is probably because of her uncontrolled diabetes. I was shocked to hear that such a low dose of insulin would mean a 38-week induction. So this is the thing. The doctors, anytime you have any kind of condition with pregnancy, the doctors are usually typically going to recommend delivering at term if you can get there safely, but right at term, not like too far out. And the fact that she wants to base her delivery date on the arbitrary number of 39 weeks and 3 days, because that's when her last baby came, it's just not wise in my opinion. And technically with a second child, you would expect them to come a little earlier. So I wouldn't even recommend waiting just because her last baby was at 39 weeks. So this was my response to her. And I didn't focus on her age or anything else. I just wanted to speak to the diabetes. And so I said, your diabetes isn't technically considered controlled if you have to take insulin. That's first. Second, your docs will document that they made their recommendation and you declined, thus leaving you on the hook should something unfortunate happen in the outcome. And I said that because she said, so I pushed back and they are convinced that we can wait until 39 weeks. No. They are not convinced. They made their recommendation to you and you convinced yourself that 39 weeks was good. And so that's guaranteed what they're going to document. Extensive conversation had discussing the risks and benefits of delivering at 38 weeks versus 39 weeks. Patient insist on delivering at 39 weeks. That's just what it's going to be. They are not going to be on the hook for you deciding that you want to go longer than their trained research-based recommendation. And so I'm just letting you guys know how this goes down. So while type 1 diabetes and gestational diabetes are technically different, it is all hormonal and based on the function of the pancreas. So different, not different. You have to also consider that excess amniotic fluid is also a risk factor in itself, and that with an induction, the doctor isn't recommending because they just want to get you delivered. It's usually because they don't want the baby to grow excessively large, which is common with babies of diabetic mothers, thus creating a risk of the baby being too big to be delivered vaginally. Okay. I like to think of it as these inductions are being recommended by your doctor to give you the best opportunity possible to have a vaginal delivery. So that's how I want you guys to think about it, right? Because knowing that babies of diabetic mothers tend to grow bigger, they want you to have a vaginal birth. So they want to get you induced for other reasons too, but also because they want you to be able to have that vaginal delivery, and you cannot deliver a baby vaginally if they are too big, right? So again, the baby growing large could be the difference between a shoulder dystocia, which is very scary and life-threatening for the baby, and a C-section. Either can still happen at the recommended induction gestation, but the chances are less according to research. Is this smart? I think it's interesting to ask strangers on the net whether a recommendation made by educated, trained doctors who are following years of research and an international standard that you decided isn't for you is smart. At the end of the day, I always recommend doing what you're comfortable with, but make sure you have all the information and you're asking all the necessary information. I'd recommend asking your doctor what your baby's estimated fetal weight is at this moment, and going from there along with other questions that you should have. So, I just want people to have the best outcome possible, but I also want people to be very reasonable. And I'm going to come back with another post about an unexpected and unfortunate outcome. But there's some things we can take from it, just, as a learning piece. Now, for gestational diabetes, this is not something that's like the mom's fault. And I often see this in the subreddit as well. People are like feeling really guilty that they have gestational diabetes. They're feeling really guilty that, they may be harming their baby. They're feeling really guilty for wanting foods that are normal to want while they are diabetic, or for like having a oopsie in their diet and, spiking a blood sugar. There's no one's perfect. First of all, this is not anyone's fault, right? This just happens. But also, no one is perfect. And so I don't want women to sit around expecting moms and blaming themselves if they had some fries. Okay, I mean, don't eat them all day, every day, right? But like, okay, it's been a few weeks and you haven't had a starch thing, get your, if you eat your fry, okay, it's not the end of the world. You know what I'm saying? It's not. And so just do the best you can with the information that you have. And, things will work out how they're supposed to. So I want you guys to just remember that, yes, you can go to Reddit. I think it's a great place to have conversation and build community. But just be mindful of the advice you take or following the actions of someone else, because she could go to 39 weeks and do absolutely fine. And I hope that's what happens for her. But just because she does that with uncontrolled diabetes, gestational diabetes, doesn't mean that you can do that and have the same great outcome, right? And most people won't come back to the internet and say, I followed someone else's recommendation on the internet and it didn't work out. So just keep that in mind. But let me know if you have questions, and I hope that you like, subscribe, share, and follow for more. Bye.